Hi, I'm Esther from Skylark First Aid. This is a really quick video as a reminder to show you how to do CPR on an adult. So this is perfect if you've been to one of my courses and you just need a really quick reminder, literally within a couple of minutes. There is another video that's in more detail, so if you want to know a little bit more about CPR and want a better reminder, a more comprehensive reminder, have a look at the videos because there's another one that says CPR in more detail. So this is just a really quick version of it. So CPR, cardiopulmonary resuscitation, used for an adult when they're in cardiac arrest. And we know they're in cardiac arrest because they're not breathing at all, or they're doing agonal breathing, which can be laboured, noisy, gaspy breaths that don't look right at all. They're definitely not what we would consider normal breathing. So make sure the ambulance is on the way, ideally get somebody else to phone and you start CPR as quickly as possible. 30 chest compressions followed by 2 rescue breaths, and we just keep repeating these 2. You can do just compression CPR if you don't want to do the rescue breaths, that's absolutely fine. Ideally, you do both. So doing compressions alone more than doubles somebody's chance of survival. If you can do the rescue breaths as well, it will triple their chances of survival. So it does make a huge difference if you are willing and able to do the rescue breaths, but it's not absolutely given. It is up to you. If you don't want to do them, you would just do continual chest compressions. So 30 chest compressions in the centre of their chest. So there's the rib cage, your hand goes just above that, strongest hand down, other hand on top. Pull your fingers up a little bit because all the pressure is through the heel of your hand. You're in the centre of the chest on their sternum. Get yourself over and above them because the compressions are directly downwards. Lock your elbows, nice strong straight arms. Shuffle your knees back a bit so that you're using your body weight to press down. We're going to press 30 times at a speed of 100 to 120 compressions a minute, so that's about 2 per second, and we're going down to 5 to 6 centimetres. No more and no less. It needs to be 5 to 6 centimetres for these compressions to work and to be as valid as possible. 30 compressions. Make sure you come up completely before you press down again, so you're allowing the rib cage to recoil completely before you press down, but make sure you keep your hands in contact with them all the time. Then you can do your 2 rescue breaths, mouth to mouth or mouth to nose. It doesn't matter which one you do as long as you close the one that you're not using. We usually do mouth to mouth. Fingers on chin, hand on head, open the airway. This hand squeezes the nose shut, this hand pulls the mouth open. Your mouth needs to be open wide. Curl your lips in, curl your lips out, not in, because you're likely to get more bruises around them, and you're covering their gums. So it's not lip to lip, it's around their gums to make a seal. And blow for about a second. Watch for the chest rising out the corner of your eye. Breathe in, second breath into them. Remember, we breathe out 3/4 of the oxygen that we breathe in, so we're definitely giving them enough oxygen. As soon as you've done your 2 breaths, put your hands straight back onto them again, fingers pulled up, lock your elbows, and you're back to your compressions again. Don't panic if it's not exactly these numbers. Aim for 30 and 2. If you did 28, would it matter? No. If you accidentally gave 3 breaths, no. But try and stick to this as much as you can. Keep going until you're absolutely shattered. Swap with somebody else if you can, that would be great, another first aider. Obviously, if they show signs of life, so they start breathing, you would stop. If the situation becomes dangerous and you need to leave to protect your own safety, then of course stop. But keep going until somebody else comes to take over from you. As I said, there's a longer video if you want a bit more information, but if not, I hope you've used that reminder to refresh your memory. Thanks very much.